With more things opening back up and capacity limits lifted in Arizona, we turn to our ABC 15 Health Insiders, helping keep you and your family safe and healthy. Dr. Janice Johnston and Dr. Ross Goldberg are with us tonight. And let's start with businesses potentially becoming more crowded. What's the advice you're giving for people who maybe do want to go out for dinner or drinks? Dr. Johnston, let me start with you.
So I would consider your own personal risk. So if you're someone with a lot of medical conditions or older and COVID may affect you more, I would really consider your risk before you go out. You might want to consider going at an off time. If somewhere that you go to seems to be crowded, you might want to go somewhere else. You might want to try to eat outside. Just really make sure that you're considering all your risks when you do go out.
Yeah, Dr. Goldberg?
Yeah, I would agree with that. Also, obviously, wearing a mask is always very important. I mean, you can't eat with a mask on, so obviously when you're at the table, you feel free to take it off. But again, be wary of your surroundings. That 6-foot distance still has relevance even when you're inside. It's keeping that distance from people, just being mindful of your surroundings. Again, we're slowly getting back to normal. We just all have to continue to be safe as we do it.
Yeah, we know the COVID cases are declining. They're averaging right around 1,200 a day right now. We're up over 2 million vaccines. Dr. Goldberg, what do you think the benchmark should be to back off some of those mitigation measures that you were just talking about?
Well, the one thing we've all been preaching is herd immunity, right? You want to get to that level where it's safe to go out kind of around in a group. And so we're still preaching that. You want to get to that herd immunity 70, 75%. New estimations keep on kind of changing the timeline, whether it's going to be summer or it's going to be in fall. As we get more vaccines in arms, that will speed things up. But I would still go for the herd immunity.
Yeah, Dr. Johnston?
Yeah, absolutely. I think that's what we're looking for, and to get more and more people in the community vaccinated. And as more doses become available, we are going to be able to vaccinate much more people within the community. And I would encourage anyone, when it's your turn or you have an opportunity to get vaccinated, don't hesitate. Just go ahead and get vaccinated.
Yeah. So let's pick up on that a little bit. The vaccination numbers, again, are certainly picking up. More than 2 million doses out there now. If someone has been vaccinated or perhaps will be soon, what should or shouldn't you be doing in terms of your own personal behavior and responsibility?
So we do encourage people to continue to practice all the good measures, even if they've been vaccinated. So making sure you're wearing your mask, social distance, keeping in your own social circles, all of that. Even if you've been vaccinated, you're not going to get sick or severely ill from COVID, but you could still carry and transmit that to someone else. So it's going to be important that we continue to follow all the guidelines that we've been doing for the past year until we get to that good herd immunity level.
Yeah. And Dr. Goldberg, it sounds like you agree.
I couldn't say it better myself. You see, I'm wearing my little vaccination pin, but I still, everywhere I go out, I'm wearing a mask. I'm social distancing. Again, I'm not worried as much for me getting it now or getting a severe version of it, but I'm still worried about giving it to others because we don't know all the data on that. And again, we're not at herd immunity, so I still need to practice what I'm preaching to keep everyone else around me safe. It's just good healthcare to do that.
Yeah. And what about the variants that we hear so much about? Dr. Goldberg, how big a concern once you're vaccinated are these variants?
Well, so far things have been encouraging. I haven't looked at all the data, but from what I heard, the Pfizer and Moderna are doing well. What's actually encouraging is the Johnson & Johnson trial was done during the variants, right? It was done recently. It was done in South Africa. It was done in Latin America with still really good results and still 100% prevention of hospitalizations and deaths. So if we get our vaccines and do the mitigation strategies, we should be able to stay ahead of the variants so they can't outpace us.
Yeah. And Dr. Johnson, I'm going to give you the last word on this one.
Yeah, I completely agree with Dr. Goldberg. I think things are looking really good. And we can see, as we've started to vaccinate within our communities across the country, that the levels of COVID are going down dramatically. So definitely, vaccines are making a huge impact within the transmission and the overall picture of COVID across the country.
Yeah. Dr. Janice Johnston and Dr. Ross Goldberg, thank you as always. We deeply appreciate your insight.
You're welcome.
Good night.